And then Natascha, whenever you're ready, please go ahead.
All right. So hi, everyone. Again, my name is Natascha. I'm with Benefits in Action. We are a nonprofit here in Colorado. And let's see if I can get this down here. We help with health insurance, government benefits, so Medicaid, Medicare, Connect for Health, Cover Colorado. We also help with, SNAP, LEAP, and other programs. We provide education, navigation, application assistance. We are a Medicaid certified site, and we are across the state of Colorado. And sorry. Oh, there we go. I guess I cannot get it. Okay. There we go. So SHIP is the State Health Insurance Assistance Program. We provide unbiased and individual Medicare counseling. We have certified counselors to help. Most of them are volunteers. And we can help with appeals, plan comparisons, help with fraud and abuse. So Medicare is federal health insurance for those who are over 65. If they're under 65, they would be on Social Security disability for 24 months. People with end-stage renal disease, ALS, and U.S. citizens are lawfully admitted. Resident aliens for 5 years. And Medicare is administered by CMS, the Centers for Medicare and Medicaid Services, and enrollment is done through Social Security or Railroad Retirement Board. Medicare is an individual choice, so you're not gonna, when you become Medicare eligible, or if your spouse, it's just yourself, Medicare is yours only. There's no family, or you don't share it with your spouse or family. And let's see. So Medicare, there's different parts. Medicare Part A, that's the inpatient hospital, skilled nursing, some home health, and hospice. Medicare Part B is mainly doctor visits, prevention, some therapy, ambulance, and DMEs. Medicare Part C is the umbrella for the Advantage plans. Those are the HMOs, PPOs, private fee-for-service plans. And Medicare Part D is the prescription drug coverage. Medicare supplements are also known as Medigap, and they help with Medicare as a secondary, so they help with copays and out-of-pocket costs. Medicare enrollment, the main enrollment period is when you turn 65. So the 3 months before you turn 65, the month of, and then the next 3 months, that's your open enrollment period for when you're first becoming eligible for Medicare. Part A, there's no monthly premium if you have enough work quarters. So it's those who have to have 40. That's give or take 10 years of working full time. If you do not have the 40 quarters and you have to pay, so if you have between 30 or 39 quarters, is $274 a month. And if you have less than that, then it's $499 a month. Pretty expensive. And to enroll is under Social Security. Part B is, there is a premium, it's 164.9 in 2023. That's actually down from what it used to be at 170. So it's the first time I've seen that happen. There is a penalty for late enrollment. It's 10% for each year that you were eligible but did not enroll. And it does not go away for the most part. It goes on to every month for the rest of your life. So it's, for each year it accumulates 10, 20, 30, and so on. So. With Medicare or original Medicare, so that's if you have just Part A and B, You can go to any healthcare provider that accepts original Medicare anywhere in the US. So there's not a network. You can go anywhere that again takes Medicare. Part A deductible is $1,600 this year for 60 days. And the benefit period for Part A, that means every 60 days. So if you go to the hospital and you have to, you pay your $1,600. If you're out of the hospital, in 62 days, you go back, a month later, your deductible is back on. So it's not yearly, it's benefit period, which is 60 days. And then after that, your coinsurance you have a coinsurance for up to 150 days. For skilled nursing facility, you have to be admitted to the hospital at least 72 hours. And that's how you can have Part A to cover those costs. Part B annual deductible is $226 this year. That is yearly. So after the deductible, you pay 20% for your copays. Any questions on that? So again, Medicare Part C is the umbrella for the Medicare Advantage plans. Those are HMOs, PPOs. They offer what Medicare offers, but better. Medicare doesn't usually cover dental, vision, hearing. So the Advantage plans, they cover the medical, the hospital, the prescriptions, and then they can offer special packages that include dental, vision, and hearing. So it's a network of doctors. You have to go to their specific, hospital networks. So it's on that network area. You have to have Parts A and B. You can have a premium from $0 to $197 a month. So it just depends on which one you choose. Usually, the more you pay in premium, the less you pay when you're in the hospital as an inpatient. The out-of-pocket maximum is $7,550 for an HMO and $11,300 for a PPO. And it is based on your zip code. And you can help find the plans on Medicare.gov, or you can call the SHIP office, and then we can help with choosing a plan that's available in your area. Prescription drug coverage is known as Part D. So you can have that either by a standalone prescription drug, if you have just original Medicare, or you get it under Part C, the Advantage plans. So if you go with the Advantage plans, it's whatever the formulary of that plan offers. And again, you can do it on Medicare.gov, or you can call Benefits in Action and have them or volunteers choose a plan. So we would just need, the name of the drugs, the names, the quantity, and so on, and then we can run a plan finder. So the cost for Part D, it ranges between $3.50 to $120.10, and that just depends on, again, the prescriptions you're taking. Some of them are going to be, the higher tiers, so you may get a better coverage, paying more for the premium and a better coverage with the plan. You pay the premiums. There's going to be an annual deductible, no more than $505, and you have co-payments or co-insurance. And I'm sure a lot of you heard about the donut hole. So it's a gap. It's a temporary limit on what your drug plan pays. And this year, if you have to spend $4,430 for covered drugs, then you go into the gap. Then in the gap, you pay 25% for brand and generic drugs. And then once you paid an additional $2,620 out of pocket total, you get out of the gap and pay about 5% copay for the prescriptions. Medigaps are the supplement insurance. It can be a little confusing because the supplements, they go the standardized with letters A, B, D, and so on. It's separate from Medicare Parts A, B, and D. So there's the average cost in Colorado is $120 to $200 a month. That's depends on your age or disability, and we'll talk about that in a second. It is regulated, so that plans don't just charge whatever they want to charge. They have to go through the Division of Insurance for that, and it pays secondary to Medicare covered services. It can pay deductibles, co-insurance, and co-pays. It does not pay for the Part B premium. It doesn't work if you have an Advantage plan, and it does not include prescription drug coverage or eye exam, things that are not covered by Medicare, basically. So the Medigap's pros and cons, it's nice because you can go to anywhere in the country. So again, you're not restricted to a network. You don't need referrals. So, if you have original Medicare, you have the Medigap to just pay right after it. It covers pretty much, depending on which standardized plan you go with, it covers most of the costs. It covers the Part A deductible, which again is $1,600. So if you have chronic illness, you're going to have surgery. That's a good plan to have if you're going to be in the hospital a few times. And it can include foreign travel emergency, cover those costs. And the con is they can be expensive. If you're low income, $120 to $200 can be a bit, a good chunk of change. It does not include the drugs, and it does have restrictions for when you can buy one. The guaranteed issue is the first 6 months from when you become eligible for Medicare. So meaning in those first 6 months, they cannot decline coverage. They cannot refuse to sell it or do medical underwriting because of your health conditions, or they have to take you. You cannot change the company's or letter, or the letters like from plan A to plan B or whichever. You're kind of stuck with it for the lifetime of it. And it's just it's a bit restrictive when just when you have to get it time period. So if you do have original Medicare Part A and B, or you have both parts, you have different paths. So you can go with original Medicare A and B, get a prescription drug plan standalone. And then if you do want the supplement, you can purchase that. With the Medicare Advantage, the same thing, you have to have A and B, and then the prescription drug is going to be wrapped into that plan, so you have to use the formulary of the plan you chose. There are plans without drug coverage, but that's kind of restricted if you have creditable drug coverage. So if it's like an employee drug coverage or VA and so on. And this is just, it's basically the same thing. With the Medigap, the premiums can change throughout the year. It has to be cleared with the Division of Insurance. They can't just, go ahead and increase $100 just because they felt like it. You can go to any doctor in the country that accepts Medicare. You don't need a referral. And so especially for snowbirds, you can use it anytime. They don't change much during the year. Medicare Advantage plans, you're pretty much locked into them. When your coverage starts January 1st, you're going to have this plan until December 31st. You'd have to see their network providers, and it's going to be a specific geographic area. If you have to go out of state, you have to get, or out of network, you have to get the prior authorization, and it does cost a little more. And the benefits do change year to year. And again, those are regulated, so they have to be approved, and you would be notified of the changes every year. Yeah, and this again is just reiterating what we said. Again, Medicaps don't cover prescriptions. If you need dental, hearing, you would have to, purchase one on your own. Medicare Advantage can offer those services under their plan. And if anyone has questions, I can take some questions.
As of now, we don't.
All right. So the Medicare enrollment periods, it can be a little tricky, but mainly the initial enrollment period is when you turn 65, again, 3 months before your birthday month, and then 3 months afterwards. Open enrollment is from October 15th through December 7th, so it's coming up. At this time is basically if you have Medicare already, but you want to change plans, or as they call it, refresh your coverage, so you can see the changes that are coming in, if it's not going to work for you, or if there's a better plan coming out. That's the time that you can switch. And then when you do switch during this time, your coverage starts the 1st of January. Special enrollment periods means that when you move out of a current plan service area, if you left coverage from your employer, if you have both Medicare and Medicaid, so that's called the dual eligibility, or if you are enrolled in a 5-star plan. Kaiser has been for the most part, the only 5-star plan every year. So it means you can enroll, if you have original Medicare, you can enroll in Kaiser at any time of the year. You do not disenroll any time of the year. So if you don't enroll in Medicare when you're first eligible, you just decided I don't want to, either you didn't know you had to, or if you don't have, basically if you don't have credible coverage, say through an active employer, or under your spouse's active employment. So if you didn't sign up, you didn't have credible coverage, that is considered late enrollment. That's when you have that 10% penalty for each year. You can only enroll in Parts A and B during January 1st and March 31st. So if you miss that opening for enrollment, you're going to have to wait until January of the next year. It used to be that you would have to wait until July 1st after you enrolled. They have changed that now. So once you enroll, again, between January and March 31st, it becomes active the 1st of the following month. In Medicare, is always the 1st of the following month if you enroll either Advantage Plan, Part D, Medicaps, it's always afterwards. So again, to delay Parts A and B enrollment, obviously if you're not 65, if you have employer insurance, again, either current under you or your spouse is actively working, if the company has more than 20 employees. Part A, or I guess Part A and Part B are basically the same. The difference with Part A that you have to be careful with is if you have an HSA, if you're contributing, so you do have to stop that 6 months prior to enrolling in Part A. They don't work together. And then you can also enroll if you you were working, you had credible coverage through your employer, and you're retiring, then you have that 8 months to enroll in Medicare. Another thing to be very careful, COBRA is not creditable coverage. So if you stopped working and you were offered COBRA, you're over 65, COBRA is not credible. You have to take Part B, otherwise you're going to be paying a whole lot for COBRA, and then you're going to be incurring the 10% penalty, and then you might have to pay your insurance back because if you were eligible for Medicare and you didn't take it, the COBRA is not credible coverage.
Someone asked Medicaid and Medicare ? I was told I couldn't receive both, no matter low income qualified. Could you clarify more?
And I will get there, but yes, you can. So Medicare, once you're eligible, is going to be your primary, no matter what. But you can get Medicaid afterwards, and yeah, I'll touch on that in just a couple slides. There's the Extra Help program. That's a federal program through Social Security. So it can pay for parts of your Part D or C premiums, and it does take care of the deductibles, and they are eliminating the partial subsidy. So if you are eligible, you're just going to get full subsidy, basically. It's also known as Extra Help or Low Income Subsidy, or LIS. It gets rid of the copays, or some of the copays of the deductibles, and it does eliminate the donut hole. So then you don't have to pay that 25% of the coinsurance during the gap. So for prescriptions, help for the prescriptions, your gross income has to be less than $1,610 a month for a single, and $2,178 for a couple. The assets or resources or a little bit higher than the Medicare savings. It's $14,790 for single and $29,520 for a couple. So Medicare savings, that is technically Medicaid for those who have Medicare. It's just very specific, so it's technically partial Medicaid. So for the Medicare savings, there are different brackets of income. So if you're under, and I don't have the number at the top of my head, but it's just about 1,200, or actually less than that. So there's different levels. So if you make within a certain amount, you get a certain amount a month, you would be eligible for Medicare savings QMB, or qualified Medicare beneficiary. And that means that the state or Medicaid pays for your Part B premium, and it helps with your out-of-pocket for your co-insurance for doctors, the deductibles. So that's, again, it's partial Medicaid. It doesn't give you full Medicaid benefits, like dental, vision, some for those who have full Medicaid. And you have to after the QMB. So if your income is up to $1,660 a month for a single, the state will pay for your Part B premium, but not your out of pocket. It's not going to cover your doctor visits or anything. So it's strictly just, and it gives you low income subsidy for prescriptions automatically. But again, it only pays for Part B. If your income is $1,661, you're no longer eligible. The Medicaid programs in general are not flexible. So if you don't need it, you don't need it. The cash assets resources are a little bit less than the Extra Help for prescriptions. So it's $9,090 for a single and $13,630 for a couple. And again, it's not going to be flexible if your assets go over the limit. As long as you can spend it down within a month, then you're okay. And again,
Someone asked, how can you get Medicare if you're under 65 and have Parkinson's?
if you so that would be under Social Security disability. So if you're under 65, then you have to apply for Social Security disability, and then once the usually it's going to be 24 months under SSDI. In the 25th month, that's when you become eligible for Medicare. In SSDI, it depends again on your, how much you contributed into Social Security. And just to, so for Medicaid, so there's different ways you could be under full Medicaid and have Medicare. If you are on SSI, SSI is Supplemental Security Income. So that's generally for those who had disability their entire lives, so they didn't contribute into Social Security because of a disability, so they don't have the work orders. Another way that you can qualify is through the Medicaid buy-in for working adults with disabilities. So you have to have a disability either under Social Security, SSDI or SSI, or if you're over 65, because you age into Medicare, you would have to fill out a Medicaid disability application, and it goes by the same condition standards as Social Security. So, Social Security has something that says, yes, you are a disabled person. When you're over 65, you fill out the Medicaid application, and then they process it that way. So you're not getting extra benefits from Social Security or anything like that. It's just for the medical purposes. But the disability and the work requirement is 1 hour a month, and it gives you full Medicaid. So Medicaid would be full after Medicare, so as a secondary, so it would work like a Medigap. It covers dental, it covers vision, all those services under Medicaid that Medicare would not cover. And then there is also, and I know for Parkinson's, this is something that we come across quite a bit. So, and I know my coworker had a presentation regarding the issue as well. So there are the long-term care services waivers. So there's the home and community-based services waiver, assisted living, and then skilled nursing facility. To put it like very broadly, the eligibility, the income has to be under a certain limit. The assets are usually the problem because it's a $2,000 limit, but there are ways to spend down. So I'm just giving information very broadly. But yeah, so if you're eligible for the home and community-based services waiver, for example, it allows you to have assistance, having like a home care agent come in, helps you buy, purchase durable medical equipment, so if you need a stool for your shower, if you need a lift, if you need a ramp, things like that, those waivers do assist. The Medicaid waiver picks up what other health insurance, Medicare will not. And again, if you need to, if you would like more information, if you want to apply for that, I feel free to give us a call, and then we can help with those applications. And then we have the Senior Medicare Patrol, or SMP. It just empowers Medicare beneficiaries, families, caregivers to prevent, detect, and report healthcare frauds, errors, and abuse. So we have the 4 R's for fighting Medicare fraud. One is record, review, report, and remember. So record your doctor's appointments, your tests and services, save your receipts, save your statements of when you went to the doctor's. Review, compare the dates and services, review your Medicare summary notice, the explanation of benefits. And then if you do suspect Medicare fraud, you can call us or the Medicare fraud line. You can also report fraud to the Office of the Inspector General, and I have the information here. And then lastly, remember to protect your Medicare number. You never give your Medicare number for some special offer. Don't let anybody use your Medicare card. Never use somebody else's. Medicare or Social Security will never call you unless you call them asking for a call. So if you get a call from somebody saying they're Medicare or their Social Security, hang up, don't call them back, then just report that call. But don't give them any information because again, they would never call you unless you request it. A good reason for you to check your Medicare summary notice, which is all the claims, the services that you've had. It comes out quarterly. So it's a good reason to look at it is to see if you've been charged for something you didn't ask for. There's a bill from a doctor you never been to. We have lately seems to be most people who have a Medigap for some reason have been billed for COVID testing supplies. So Medicare has been charged for it. You never asked for it, you never received it. But when you look in your Medicare summary notice, there's the charge to Medicare. So you have to keep an eye on that and do report it. Even some of our SHIP volunteers who have Medicare and they have a Medigap, that has happened to them. So it's pretty widespread. Offers that are too good to be true. It's like, you just call us, Medicare will give you a wheelchair, a scooter, free genetic screenings. Always check this, if it's something that is legitimate, because a lot of times they are not. They're just trying to, get your Medicare number and scam. That's basically it. If you need any help, again, questions, you can call us. There's our information. You can always call Medicare directly. We have the SHIP volunteers at our office. So if you want to schedule a time to talk to them, and then Social Security, our office can help with Social Security disability. If you have questions on applying for it or how it works, we have a couple staff that can help you apply. Any questions?
You can type in the chat, you can unmute if you have a question. How can you get both Medicaid and Medicare?
So Medicare is based on age or disability. So after you turn 65, or for the most part, if you have, if you are on Social Security for 24 months, sometimes you get it less than that. So you have to be 24 months under Social Security disability, and then the 25th month you become eligible for Medicare. Medicaid is based on disability, income, and asset resources, depending on the program that you're applying for. The Medicaid buy-in only looks at your income and does not look into your assets and resources. So it allows you to have a higher income and still be able to get on Medicaid, full Medicaid. But again, you have to have a disability, either under Social Security or by applying for the Medicaid disability that goes by the standards of Social Security. That one, it's a little more flexible because it's not going to provide you with income like Social Security. It just provides you with the eligibility to get on Medicaid. So for the buy-in, you have to be have a disability and you have to be able to work 1 hour a month. And it can be anything. So if you're babysitting, if you're taking care of someone for 1 hour for $5, that would be something to consider as an employment. And then again, there are the waivers. So home and community-based services waiver, assisted living waivers. So those have very specific income and asset limits. It is based on the person who is applying, not the spouse. If only one person is applying for it, then it's only their income. If the person applying is over income or over resources, there are ways to qualify. So if you have any questions, if you need more information to see if you're eligible or somebody that you know may be eligible, absolutely give us a call and then we can help apply for those programs. But Medicaid will always be secondary to Medicare.
Any other questions?
I have a question. Can you hear me?
Yes, go ahead.
Okay. So when you're considering all of your options for Medicare and any assistance programs, they're just looking at the income and assets of the person applying, even if they're married. They don't take into account anything of the spouses?
No, so that's the little confusing too. Medicare Savings Program specifically, that one is the one that's technically partial Medicare. It does take in consideration the spouse. So it is going to be if you're married, your husband, wife, both incomes and assets are going to be considered. For the Medicare, the Medicaid waivers or the buy-in, it's mostly the person who is applying for the benefits. So the buy-in, it is the person applying and the assets are not counted with the again, HCBS or long-term care. Then it is the person applying, but there's a limit to the assets of the spouse. So if the spouse goes, there's a limit for their asset. It's it's over 150,000, something like that. But there may be that issue. If you have Medicaid, if you're approved for the Medicaid buy-in, then you can apply for the HCBS waiver, and they will not. The county will not take into consideration your assets or your spouses. It goes away. It overrides it, if you will.
Thank you.
Someone asked, how does Medicare work with TRICARE for life?
So TRICARE, it works as a Medigap or a supplement. So it picks up pretty much everything after Medicare.
As a follow-on to that question, so with TRICARE for Life, do you have to have the Medicare Advantage plan, or what other costs or plans do you have to have with the TRICARE and Medicare?
TRICARE actually does cover after Advantage plans or original Medicare. Yeah, I mean, TRICARE is the best you can have. It picks up everything.
Okay. All right, thank you.
And one thing, I guess it just Nody just reminded me. The only folks who do not have to enroll in Part B are federal employees. So if you're a federal employee or your spouse and you're under their insurance, Technically, you do not have to take Part B. You can keep that insurance forever. The only thing is in the future, 10 years from now, for whatever reason, you have to drop your federal insurance, you will be subject to a penalty, to the 10% for all that time. So technically, you don't have to take Medicare, but when you do, if you do that, then you will have the penalty incurred.
Alrighty, last call for questions before we're done today. Okay, alrighty. Well, if you have any other questions, you can let me know and I can pass it forward to Natascha, or you can just call Benefits in Action directly. Thank you all for being here today. And Natascha, is there anything else you'd like to say before we finish?
No, just thanks for having me. And yeah, absolutely. Any questions, give us a call.
Alrighty, thank you so much, Natascha. Thank you everyone for attending. Have a great day. Thank you.
Bye.
Thank you.